A very good morning to everyone. My name is Yuva from SMK Tatasago Lanka, and I'm here today to talk about a very interesting topic, which is about coronavirus. I assume already all of you know that what's been going on lately around the world. This specific virus is making a lot of headlines on the news. To begin with, let's talk about what is coronavirus. Well, coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome and Severe Acute Respiratory Syndrome, or in short SARS. A novel coronavirus is a new strain that has not been previously identified in humans. So, how does the virus spread? The virus is spread via droplets when a person coughs or sneezes, and not only that, it can be also spread by coming into contact with infected areas. Now, imagine you get infected by the virus and you're showing some signs of infection. Common signs of infection include respiratory symptoms, fever, cough, shortness of breath, and breathing difficulties. In most severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Of course, no one wants to get infected, so how do we prevent infection spread? Standard recommendations include regular hand washing, covering mouth and nose when coughing and sneezing, and avoid close contact with anyone showing symptoms of the respiratory illness such as coughing and sneezing. The outbreak started in Wuhan, China, but has rapidly climbed the rest of the world. More than 14 million cases have been confirmed since the outbreak started, and the death toll has exceeded 600,000. The vast majority of the cases are in the United States, and the virus has spread to more than 200 countries. In Malaysia alone, the total confirmed cases are 8,897 as of 26 July 2020, and out of those cases, 8,600 of them have successfully recovered. In terms of fatality rate, Malaysia has lost 124 people and there are 173 active cases ongoing. Malaysia has done a very good job of controlling the spread of the virus by putting the whole country on lockdown for almost 3 months. Schools were closed and no one was allowed to go outside except for critical reasons. And it slowly began to ease the lockdown measurements as cases were starting to drop in numbers. Now, Malaysia is in recovery movement control all the phase, and schools have been reopened and most of the sectors are back up running as usual. For the past week, the amount of cases started to rise again, with 2-digit cases every day, and the government is planning to put the whole country in lockdown again, but we hope that doesn't happen anytime soon. But take my words with a grain of salt, as we are not finished battling with this hectic virus. People can still get infected, and my advice for everyone is to bring a small bottle of hand sanitizer wherever you go, and always wear a mask to protect yourself from others, as the slogan goes, #Kita jaga kita. And if you're feeling under the weather, consider going to the nearest hospital to get tested for COVID-19 just to be safe. Take precaution measures such as social distancing of 1 meter, wash your hands properly for a minimum of 30 seconds, and use hand sanitizer regularly. If you own a business, make sure to check your customers' temperature before they enter your shop. And for students, please be safe as schools have been reopened and don't get into contact with people showing symptoms of the virus. Please abide by the rules set by the Education Ministry and don't forget that shaking hands is still not allowed. When the outbreak started, China was the country with the most cases, but now the tables have turned. The United States of America is in the first place with over than 3.5 million cases, followed by Brazil, India, and etc. There is still no mainstream vaccine for the virus for now, and the doctors are trialing with existing drugs to cure it. Most of the people who got infected have defeated the virus successfully, and some of them have passed. The people can help them by following the rules set by the government to reduce the cases as much as possible. Now, imagine that you actually do get infected by the virus. What happens next? Well, you will be isolated in the hospital very far away from the other patients. You'll be alone in the room and no one is allowed to visit you to prevent infection spread. And if your condition is critical, you'll be hooked up to a ventilator. Just think about how scary it is to see doctors coming in to treat you with hazmat suits on. Now, let's think out of the box. What happens if you die? To put it into context, no one is allowed to come to see you or take your body for funeral purposes. The professionals will handle it and no one is allowed to come to your funeral. Now, think about the families that have lost their loved ones due to this virus and think about their feelings. So stop being selfish and wear a mask when you go to protect yourself and others. With teamwork, we can beat this virus once and for all. Thank you for your time.